You're on.
So it is 11:11, and I'd like to call the meeting back to order. Brenton, would you mind calling the roll?
Sure.
One.
111.
Miss Artist.
What did I say?
Present.
Present.
111, I'm
Mr.
sorry.
Blunsky. Ms. Hano. Ms. Cowitz.
Here.
Dr. Mita. Mr. Piontek. Ms. Reed.
Here.
Mr. Rocca. Here. Mr. Taylor.
Here.
Ms. Shastry.
Here,
6, you have a quorum.
thank you. I think we're on the early steps childcare section.
Sounds about right. So there's only 2 on here that kind of fall within that sort of category. So any questions that y'all have about those 2 particular issues?
What page?
We are on page 4, early steps childcare. Okay, how about training and education? That starts on page 4. Oh, it's all on page 4, right there at the bottom of the page. So if you want to take a look at those real quick.
Training and. Training.
Do we have any questions there? Any clarity needed?
Who we, training and. This is still the police, the training classes we was doing.
I think we had some in our initiatives. Our
Yeah,
planning,
we had a training initiative around law enforcement for 3 years, 4 years? I think 4. It was a long time. Yeah, so that ended our fiscal year 25 plan. We did not have it. So I think it ended with our fiscal year 24 plan.
But that one we dropped off because it wasn't really,
Yeah, we felt kind of run its course. It had a lot of participation in its first 3 years. And then on its 4th year, whenever we did it, it did not have as much participation. And so we decided to use those dollars elsewhere.
and so that's basically what we talking about on this part.
Not necessarily. I think this one is a similar concept, but they would like to see some legislation in place that would make disability a part of the training curriculum, I think, for law enforcement officers is what this sounds like.
So basically, like if they pull over and see a person that's disabled and they be trained and they know it's a disability thing going on.
Yeah, I mean, similar to that, yeah. I think if you would do something like that, you would define, I guess, what it is that you would like to see them educated on and how that would look.
Because, and I'm sorry I didn't ask to be recognized, but my thing is, I think there needs to be more training with that because you can get somebody to walk away and they're not on their meds, if I'm making any sense, and they quick to slam them to the ground and handcuff them, but you don't really know what is going on with them and they're not on their meds. And I think they need more training with that to kind of recognize, if I'm making any kind of sense to y'all. That I think they need more training with that, but I don't know if help me out somebody, cause I got a full belly, I'm trying to see if I'm saying this right thing, they need more training on it to recognize something, to be calm with, people that's got, one disability out that you don't really know, when they're in a crisis or something, I think they need to know a little bit more about that if they're in a crisis and they're not on their meds and they walk away, and I think they need more training on that type of stuff. Is that something we'll look to take on? Because I think that needs to be looked at, if I'm making any sense to you.
Yeah, I mean, it makes sense. Yeah.
Oh, sorry.
I don't know how that's going statewide. I know that in our region, we are invited and we have had people come for, different characteristic traits, different things for autism, stuff like that, to the police academy, when they're actually going through. But I think this would make it where they have to versus I think as of right now, I think it's just voluntary, they see the need and they allow us to do it, or they ask us to come do it. But, I don't think I think a lot of areas are starting to do that now because of the dual diagnosis issues and things like that. And, just like you said, they're on a meltdown, they're off their meds or whatever is too high or too low, and, they get stopped and can't explain themselves,
Right.
that what's going on, things like that. So, but on the flip side of that, when they're off their meds, at the time they don't have their IDs or anything like that,
Right.
that has that flag on there that shows, they have, that's a problem as well. So I don't know how to fix that, but.
I think, too, I know in our area, we have like a crisis center too. I think they're trying to do some, response around that where the crisis team is responding with trying to get there before police to de-escalate situations versus having the police handle some sort of a episode like that or a meltdown. I don't know how well it's working, but I know we have a crisis center in our area specifically for.
Yes, because I got a cousin that has breakdowns, and if I didn't see his book sack, he was in the middle of Florida Boulevard, screaming, hollering, and then so I was like, told my DSW, hey, keep me out the truck. And she thought I was crazy, and she was like, get you out the truck, we in the middle of. I said, see my cousin's book sack, but they didn't know he was at a crisis moment. And I was like, what you doing? He was like, I'm hungry, I don't have my meds. And I was like, look, back up, let me handle him. The more they came to him, the worse the situation went. But by him trusting me, then it came to a peaceful moment. And I think they need more training to it where they can recognize it, not somebody just, oh, let's slap him on handcuffs and let's take him here. I think we need a little more.
I agree. I
Training.
think we need more, but I do have to say that I have to commend our human service districts. Since they've all come together and you have the 3 houses under one umbrella, the streamlining of services has gone much better, much faster, especially for our dual diagnosis. If they are having a crisis, to get more quickly get into whatever services that they need, whether that's mental health or, DD or whatever that they need. It's easier and quicker for us to be able to get services to them, so.
But I was gonna say, I do agree that there should be more training and everything, but there is going to be difficulty in distinguishing someone who's belligerent sometimes versus someone who has a disability. So that's gonna kind of be a disparity right there, because that opens up other dangers.
Yep.
Correct.
If you're being more gentle because you have this disability training when you're dealing with someone who might be very dangerous, you know, so.
Just-
But I do agree that there should be just more knowledge out there by the law enforcement officers when they are dealing with, anyone with a disability.
See what you're saying? You know, like you could tag them, I let them out tag, hey, this is what's going on, you can't put emergency tag on them, hey, they understand what you're saying. And,
And there is, and we were talking about it actually during lunch, there is that program where you can go and register a person with a disability with the police department, with the state troopers. So there is that capability to be able to establish like, oh, we're dealing with someone with a disability. But I have a lot of law enforcement family members. And this is actually discussion often, so.
Yeah, I think there's a handful of disability groups out there that I know do trainings for law enforcement because I see them advertised from time to time. I do know whenever we did our initiative, there were, I don't remember how many agencies, but there were some agencies that were involved in the initiative. Now, in the initiative that we did, I think we trained 800, maybe like almost 1,000 people over 4 years. Like it was a very large number of law enforcement and first responders throughout the state that were trained over that 4-year course. But so there were some agencies that were starting to have social workers, mental health professionals that would be able to do, I don't want to say ride-alongs, but similar concept in that they could be responding to that situation with an officer who is there to keep everyone else safe, and they would be in charge of, intervening with that individual that might be in some sort of crisis situation if it's identified not to necessarily be a criminal matter, more so behavioral health or something related to their disability. I will say that whenever you get to requiring people to do trainings, it can get a little dicey. For instance, like if you require teachers in statute to have some sort of training, then you have to convince people to take trainings away. I forget, we ran into that when we were doing the education piece last year, and I forget all the information behind it, but essentially there are these set trainings that have to be done, and if you think they need a different training, you have to pull one away. I don't remember all the background. Never claimed education was my expertise, but I know that's something. I know law enforcement, this comes up all the time. We have had conversations. Not everyone is interested in this, so I do think that's kind of been the barrier, which is why folks have taken it up as initiatives. But we'd have to do more research on this particular issue and get an idea of not only would they be interested, but the financial costs, because you would have to come up with some sort of curriculum. You'd have to pay for someone to develop the curriculum that would go within post. And this is also, I would assume, is only going to address those individuals that have gone through post. So this wouldn't address folks that are just maybe hired security, private events, those types of things, because those individuals may not have had to go through the same training as your law enforcement officials.
I didn't think that's it.
So, and for instance, like it's been a very long time since I have been a probation officer. But at one time when I was, you did not necessarily have to go through post-training to be a probation officer. And they are considered to some extent law enforcement individuals and law enforcement officers that would encounter these sort of situations. But if they never went through that training, they wouldn't have what they need. Although we did have training, not in-depth training on disability, but it was a part of the conversation. So we'd have to do more research on that one to give you a better idea of what that would look like. But yeah, you'd have to get a lot of the police unions and stuff on board as well. But I would not imagine it would be a big price tag to develop a curriculum, but it might take time. Any other questions about any of these training topics here? Any clarity needed? Any thoughts?
One is transportation and safety.
Yeah. So transportation and safety starts on page 5 of your document.
Oh, that's big one, and it's needed.
Yeah, transportation has always been a tough one.
It's always gonna be.
Similar to housing in that there are so many. There are a lot of, transportation is not, it's not like a statewide transportation system, right? It's every local town or parish or area within a town would have its own sort of transportation, I guess, that they would all, or that they would be responsible for. Unfortunately, we have a lot of rural areas, so then it's trying to figure out how you can establish some sort of public transit option in those areas. But if y'all have anything?
I mean, sorry, the second priority listed here might be, I mean, a good road to try and dealing with the first one, because as Brian said, we have a patchwork of local transportation systems, their funding is different. I mean, I think my organization has looked at this over the years too. It's just, it's a bit intractable to try to take a big stab at it all at once. But the second priority of trying to create a task force that actually look at this and maybe make recommendations, that could be a first step towards working on this. Because in terms of a plan, like I think we could go to the legislature and say, hey, let's put a mandate on every local unit to do this. That could be a pretty big lift and maybe not that feasible. So if we ask for a task force that actually maybe gets some buy-in on some kind of measurable improvements that could be made, that might actually be significant. That could be a good first step to making something positive happen. And I know in the past, my organization has even looked at trying to make ride shares more accessible, and we met with legislators on it. And the only state that's done anything like that is California. That's through a ride share tax, and the legislative we met with are people would be sympathetic to that, but even they're like, this is going to be, getting the legislature to pass a tax on all the ride shares would be a challenge. If only California has that, or this is not California, that's but
They do not want to be compared to California.
probably not want to. They probably don't. Yeah, that is not a good sell for these guys. California does this, you should too. Is probably not something that gets a lot of the legislative or majority base. But task force, if you look at that, I mean, again, it'll be a process of years involved, so task force convened, but it could be a good first step to try getting something done.
I also wrote in my notes for those that are on the council, this may also be something coming up in our next 5-year plan, I guess, that money could be put towards like trying to pay for a study, maybe like a multi-year approach. Similar concept to like a rate study, right? Have someone that has the expertise to come in and start to evaluate what we don't have, what we do have, what's possible, what maybe other states are doing. So it could also be an initiative idea as y'all move into future planning and a new 5-year plan, which I think has a transportation aspect to it, I think was included in some of the language. So that might be an option as well.
Yeah,
I think GACTA is working on starting a transportation committee, right? I think.
They used to have one.
Yeah, they're trying to get their committees back going, I think.
Yeah, I know they talked about that at their last meeting. Some of the committees that they used to have, I don't know about the legislative committee, but I know the education committee and the transportation committee, they were looking at restarting, so that would be another option.
They have my notes actually from last meeting. Hold on. So they're at least trying to create accessibility, transportation, and emergency preparedness, and maybe one other, maybe others, but we got appointed to those 3 committees. I'm leaving my organization, so they are trying to do that. So it could be something done with Captain as well.
I feel like it would be a good initiative, personally.
Well, the only option that the cities want to look at is medical transportation. Well, that's just one area. I mean, people with disabilities, and I'm saying specifically disability, need to get to the grocery store, because we only have one van, one bus that has a lift, and if it's broke, which it always is, I mean, that's a moot point anyway for anybody, and then one person a day can go somewhere, if you live in that area, because out of our 8 parishes, we only have a bus partial in one city, so we don't have it spread out like most people do.
Yeah. And then our state being so rural is the problem. We're not connected. So forget about trying to get from one city to the next.
But another problem we have too, in the country, even if you go make grocery and you're on this big vehicle, there's on a limitation of grocery that you can make to be on the vehicles. And if you by yourself, you gotta be creative. I mean, I got bags on my seatbelt, I got bags on my handle, you gotta be creative to how to hold the bags and hope nobody rob you by the time you get to the door. So I'm just being honest, that we don't need just medical transportation. We need access where we feel comfortable of pulling our money out or making grocery, because we are target on the 1st to 15th and whatever, because then they know, hey, this is when they get the bird to fly on each day or whatever, and then let's take what they have, and then some of them can't count money, so they ask them for help to make grocery, and then you got a whole nother problem right there. So it's safety too, of getting transportation.
It's a lot. But yeah, y'all right. It's more than medical. I mean, what if someone wants to go to the movies? What if someone just wants to go to a friend's house, like having that? And I feel like at least here in Baton Rouge, every year or two, you hear about this route we're taking this one away. We're taking this one away. And then I feel like I live in Baton Rouge. Technically, I live in St. George, which is connected to Baton Rouge in every way possible. But if I needed a bus, I can't get one. Even though I feel like I'm in Baton Rouge, I have no option of catching a bus out that way to take me into Baton Rouge. And so even our cities still can't get it right. So I like the idea of like a study to get that information and someone that would know about this type of stuff. And then maybe a task force comes after you have that information and how you implement what's in that study, maybe. I don't know.
Another thing you got going on is not safe if you do an Uber. You got to think about if they can transport you, because you in a wheelchair is extra money. Is extra if somebody can handle you or handle your wheelchair. It's a lot, but we don't need just medical transportation. We need something to get in these disabled complexes, and these people get paid on certain days and they need to get to the bank and move around and get a little grocery. It's a lot in that, but then it takes a lot for a lot of people to trust people, because the safety, the L is not gonna move around like I'm gonna move around, because they just don't have the support. So that's something to look at.
Jackie is right up.
Oh, I'm sorry.
No, you're fine. For transportation, where would the funding come from? Would it be state level funding, city, municipality, parish? Is that something else to take into account as well? Because those more rural areas, it's gonna be ultimately more expensive to run transportation, which is probably why we have that disparity in the first place. But that's something to take into account.
Yeah, and that's one of the things here, require municipalities to own and operate their public transit systems. Well, all it takes is money. And then you look at these small towns with folks that do not have any money, going back taxing them to provide for a transportation system. But yeah, I know there are ways that you can get state dollars to local areas for various matters, but I don't think that you could.
The same.
Yeah, I don't think you could sustain ongoing state dollars to local levels for a transportation system. Maybe you can, but this is why someone smart that can do a study would need to tell me, because I'm not that person. But I think we're already starting in a situation where we don't have a lot to go off of we don't have many systems in place. It would almost be like building something from scratch, it feels. But the council has tried for many years, not this 5-year plan, but for many 5-year plans before, to address transportation and housing, and I don't think anything has really moved the needle in any sort of way.
What a study.
I can't say a study would, but at least someone would have information for
Information,
us.
yeah.
So is there a way to put the study and the legislation to follow, or the task force to follow in the same document? You do that. Study and then.
You could, but then if you do a study legislative, I guess you would have to dictate who's gonna do that study. I don't know how much these things usually cost, which is why I was saying that might be something maybe the council can look at initiative, maybe. Even if it's like this year we're paying, so it's like, this is what they're gonna do this year, and then this year, this is what they're gonna do. Because we have we've written the upcoming 5-year plan in such a way that we can address transportation. I'm right? Okay. So the council does have a 5-year span where they can dedicate money to transportation type matters. Now I get it, that doesn't solve the problem today if you want transportation now, but I'm just thinking of more of a long-term system change takes a long time. So I'm just thinking we would have 5 years in our upcoming plan if the council would prioritize transportation, that we could look at, throwing an RFP out there, who can work with us to do a study, and can it be a multi-year approach? They might even be able to create or do the task force, because I'll be honest with you, as council staff, we don't have the ability and capacity to run a task force. And if we run a bill that says we're gonna create a task force, then it's gonna be the council is the one doing this task force. And I don't want it to turn into like how it was with the advisory council for student behavior and discipline, where you couldn't get people to sit on it, you couldn't get people to show up, and even we who helped run that bill or get it where it needed to be, couldn't get people to sit on that thing. And I don't know. I'd hate for that to happen in this scenario, but you could probably time in, is what I'm saying. If you do run it through legislation, we'd have to find a legislator to probably do some sort of resolution. There would be money attached to it, because I'm sure whatever agency they would tap in to do this task force and to do this study, they're gonna want money. I don't know how much that's gonna be. But you could do it legislatively, or if the council continues to prioritize it over its next 5-year plan, you've got 5 years that you could dedicate money to work on that. And maybe not saying the DD network will put any money towards it, but I mean, I don't know, maybe disability rights, or maybe LSU HDC, they might have opportunities to help with that as well. That could be topics that we discuss on our DD network calls, maybe.
I wouldn't count on that.
With the funding part?
Yeah.
Okay.
Wasn't guaranteed. Maybe just more of the sweat equity, it's more.
Equity.
We need the sweat equity.
We don't have the equity.
If we don't have the sweat equity, that's our problem.
The equity that comes in bags with dollar signs on it, no.
The money? Oh, no.
But I mean, I think Brendan has a good point, though. I've been serving on Senator Barrow's task force on residential facilities for years, and I don't think we've had money allocated to that. There hasn't been an actual on-site group doing a study on that. It seems to sort of meet every year, and we haven't made a ton of progress. It's coming up again, and we're trying to make some more progress on it, but that might be the kind of task force that would have noted more progress, would be one that actually has a study attached to it that you can actually look to, other than, a lot of non-experts.
Yeah.
getting together and
Mm.
coming with ideas that we can't quite put together a coherent whole. But
Any more questions on transportation and safety?
Yeah, that's gonna be 7 years and years. of work.
Move to housing? Yeah.
Housing, there's only those two on the bottom of page 5 for housing. Jump into education now. So on that page 6 there, you have multiple areas. You have the behavior, curriculum, access to services and support. So if y'all want to take a second to look through those.
And we already doing something with the school.
Which one are you talking about, Eric?
The top one.
Under behavior?
Yes,
Yeah.
that's a
Yeah.
continuation of last year's stuff.
Yes.
Oh,
I mean, this is not all parts of that legislation have even been enacted yet. So you're,
why would we open it up again?
that's kind of my.
Right.
That's what I was thinking as well.
We've just got that. I mean, it seems like
Let's let it,
going and asking, yes,
Yeah.
to reopen and redo it before it's even been implemented in part, it seems like a bit,
it's not even fair.
like a bit soon. Maybe wait a couple of years from now to see if they're actually planning properly, if there are issues, just kind of not to track.
Yeah, it's certainly important, but I agree.
yeah, there was, I think it's just having some more monitoring and accountability pieces in there. I understand. But as Jordan recalls, we tried some of that in the legislation when we ran it, and it was dead before we even would get it to the Capitol.
Mm.
It was not gonna move anywhere. So I think we're happy with the legislation that came out. Can it be better? Sure. But that monitoring and accountability piece is, I mean, the council has been trying to figure that out for years, long before I came. Whenever I looked through some of our historical stuff, that has been something that we've been trying to work on. I don't have the answer. As far as going back and amending this, I would share, this is Brenton talking, not council staff, Brenton. I would share that same thought of, I mean, there's stuff in this bill that hasn't even gone into effect yet. Like, why are we opening it up yet? We haven't had a chance to see if any of these changes will make a difference. Some of these groups haven't even got the seclusion and restraint report yet that they're supposed to get to even look at to see if there's any difference. Or to see if there's a difference between last year's report and the new year, or this year's and next year. Like, it's, I don't know. Yeah, like the cameras aspect, I think there's one about cameras in here. Well, that doesn't happen until February. They have until February. So by that point, you know, we're not gonna be going back in session to say, we need the cameras. They have until February to put them in there. If they're not in there, well, that's a problem. They were supposed to be in there.
Yeah, I just think that shows how important this is to our families.
Yep,
So we'll be looking at that again.
it is very important, but I would say the same, just letting this one go through, see how it works out this year, and then figure out what what edits we need, especially with everything going on at the federal level. What is that gonna look like?
And it does seem likely that, given the lack of implementation of the cameras in classrooms, legislation initially, we will have to revisit this at some point in a couple of years. Because can't just pass this and count on everybody complying with it and following it. We're gonna have to look at it, and there'll be probably some areas where people aren't complying, so then we'll have to readdress it, but probably kind of have to give people a chance at least to not comply before we address and say, you're not complying.
I don't understand why they don't wanna comply. I mean, that's something important to have in place. I don't understand. I mean, this is all the way around the board, this is something important. I mean, having them in place is having them in place. I mean, the funding is there.
I would like to really push for the requiring school districts to perform FBA, the functional behavioral assessment. I think, and that this would be a policy, you know, systems change. I think that that should be part of the evaluation process, especially when dealing with a developmental disability. We have a lot of phone calls currently coming into our office about ultimately it's behavioral issues within the schools, and these children have diagnosed disabilities. They have autism, ADD, ODD, emotional disorders, and they've been written up. I had one child that was written up 26 times in 34 days of school who has an IEP, and they've never done a behavioral assessment on it. And I just think that it would be prudent of the school districts to make that a part of the initial evaluation process.
Thank you, because I wasn't really sure exactly what that was, so.
So that's where they're gonna do an evaluation on the behavior and they'll develop a plan. And typically, if they're doing a behavioral assessment, they'll have different things in place. They could do response to intervention. So they'll have different steps that they'll take. You know, this is a trigger. This is what happens when that trigger goes off. This is what we can do to reduce that behavior that comes from the trigger. So I think that would be nice, because a lot of our meetings that we're doing right now are behavior related. And it's the situation that I'll go in there and I'll ask, like, why haven't y'all done an FDA on this child? You have the documentation, you have the data that warrants he needs something. So why haven't you done it? And well, no one requested. No one requested. And that's when I slide over a slip of paper to the parent, I'm like, request them right now. So, and because it should be done in writing. I recommend do it in the email, so you have a date and time stamp, because everything runs on a timeline in special education.
Say that again.
And to continue on the curriculum thing, adding disability culture in high schools, I think that needs to start at a younger age. My opinion. Maybe get more into the history in high school, but it needs to be introduced to the littles.
I'm sorry, I'm just reading the way.
So back to the functional behavior assessment, when it says just do it earlier, I'm not knowledgeable enough about the actual procedure of what's done. So in terms of earlier, what does earlier entail? And I'm sorry if you explained it just now, I just don't know when it's done, and like, is there a certain age or a certain time of the year, or what is this? Like, I just don't know.
So typically, whenever they're looking at, and I know this because I used to be a special education teacher. But typically, when we were looking at behavioral issues within the school, if a student was written up 5 times in like a month, that's something that is kind of like, okay, let's look and see what's going on with us. Is it something where it's just oppositional behaviors? we would come up with a plan, because what happens is when you have those behaviors in the classroom, it's gonna affect the learning of everyone else in the room. So that's how I did it. It wasn't a guideline or anything. There really wasn't a guideline on when to do it, but I'd have a conversation because I was going calling the parents. So I'd have a conversation with the parents and ask them, is this something you'd be interested in? Because this could reduce those behaviors, and then that all ties into having ABA services within the schools. So all of these things kind of go hand in hand. But whenever you're looking at someone with a disability, it makes a world of a difference, because schools will try to change placements. I have a school district right now that's reducing a student's hours in the day from the full school day to 2 hours per day because they can't handle them. They put that in writing. They can't handle it. And if they have some kind of plan in place and they were following a plan, they could eliminate some of those behaviors that are being written up and reported. They're suspending him. They're constantly calling the parents, and the parents are having to leave work to go pick up the child from school. I have several parents on the verge of losing their jobs because they keep getting phone calls. And that's when I say request one, And if it would be part of that initial evaluation process, it could eliminate, because they'd be watching for those behaviors, it could eliminate having a change of placement, which could be a change of a classroom, it could be a change of a school setting. It's a number of things.
I don't think you want to put the verbiage in there that it's only in the evaluation though.
No,
Because if things come up,
and I agree, but I'm saying if it's a part of that initial evaluation, if there is any type of behavioral issues, they can approach that right out the gate. But I do think that parents and families and teachers too should have the ability to say, hey, is this something that we can do down the road? Even if they have an IEP or not. But if they have that IEP, they might not have had behavioral challenges early on. Maybe they developed it over time, so that would be something to be revisited. But I think that if we make it more, more mainstream, rather than having to, because families don't know about that. Most of the families that I've talked to recently, they're like, what's that? What's a behavior plan? So, but yeah, I think it should be able to be requested at any time, and if they make that a part of the initial evaluation process, things would be addressed earlier on.
Thank you. Christina, you have your hand raised?
Shoot. 1 minute. I'm so sorry. It won't let me unmute her. I'm sorry. Okay. There we go.
Okay, can y'all hear me?
Yes.
Okay, perfect. I just want to echo what Jackie said, and I also wanted to say that that's been an issue in Jefferson Parish as well, along with using response to intervention or RTI to hold back on the process of doing a functional behavior assessment. I have parents that contact me quite often about that process. And when I ask them if they've had a functional behavior assessment, they either tell me that, oftentimes they don't know what that is, or they haven't been offered that. So when you talk about behaviors, I do believe that it's better if we start assessing those things earlier, because if not, when it becomes a problem in the classroom, if the district is either A, resistant, or B, unknowingly not doing the process correct, that could put a child extremely behind because they're not, in their least restrictive environment, or whatever the case scenario might be. And so in Jefferson Parish, we've had a lot of instances where they are using response to intervention to not do an FBA until a month or 2 months later. And by that time, this child has a substantial amount of behavioral infractions where they're reducing their hours, or they're even kicking them out of school. So yeah, I just wanted to echo that is very important.
Thanks, Christina.
Yes.
Thanks. Yeah, so the early would look like basically after a certain number of incidents, we would automatically do it, or a certain number of incidents, teachers would be required to offer that option to the parents to have the behavioral analysis done after like a certain number of incidents in a certain period of time or something like that, or?
Yes, I think right now, the seclusion and restraint, I don't remember. I haven't looked at it in a while, but with the seclusion and restraint, it was saying that if there were some instances where a child was restrained over, so many times that they'd have to revisit the IEP and rewrite it. It would be something along those lines. So, I mean, I probably do between 3 and 5.
3 to 5 in like total, or in like month, or in school?
Okay, because I mean, everybody likes to be a little silly sometimes. But I'd say like over a month or 2 period of time.
Okay.
And mind you, the instances that we're seeing, these students are being written up multiple times per week. And it's going months. And then finally the school's saying like, we've had enough. And then we're going in there to advocate with these families. And it's kind of like, well, why haven't y'all taken these extra steps? Why haven't y'all done an RTI, response to intervention plan? Why haven't y'all done a formative behavioral analysis?
Thanks.
And just to make something more standard. I think it's necessary.
I think you kind of get into, what constitutes a behavior for an FBA. And there are different types of behaviors that can be addressed through an FBA and a BIP. And it's kind of hard to put a quantitative number. If you have an explosive situation once every 3 months versus 3 to 5 in a 4-week period, I don't know how you solve that problem. But that certainly, FBA should be done, and parents shouldn't have to come get their children. They should know that they shouldn't have to pick their children up
Exactly.
unless they're suspended,
Or the extent of circumstances.
because they're working out for 10 days.
Exactly. But the tricky part about it is those 10 days, they're not counting. They're not counting the parent picking up the student halfway through the school day as part of the 10 days.
So
And I
it's
can say that specifically for one school district that I work with.
10 days being sent home, or 10 days what is the 10 days? 10 days of what?
Of not receiving special education services,
Okay,
being placed outside of it's outside of.
so being asked to leave school.
So when you're written
Yes.
up, you have documentation of the
Yes.
day. And when those add up to 10, they can't do that anymore without addressing it.
Got it.
It can also just be like, or at least one of the school districts I worked at, it was when they just like removed them from the classroom too.
Mhm.
So like, I think part of, or at least how I read it, even the undocumented removals could be like, I taught high school, so they had resource teachers, so you need to go to your resource teacher, that's removing you from the learning environment. And that can count as part of your time for those 10 days.
Got it.
Or it's supposed to. Let me rephrase that.
Anything else on page 6? I will say under the curriculum piece, I think it was brought up earlier, one note I had here, I'm not sure the whole process of developing and getting curriculum in our elementary, middle schools, high schools, wherever we would want to look, but it might be a good council initiative to look at developing curriculums or trainings or I think we would have talked about a book of some kind that can be given away, just to help if that is something that the council finds important of getting someone to develop something about this disability, yeah, disability, culture and history, we could look at training specific to that. You could look at what it would take to develop a curriculum, although that's a little bit different than developing one than trying to actually get it into all the schools. But anyway, that's just a thought, a possible initiative that you could look at as well as part of your next plans.
There's a hand raised. Adrian Burns.
1 second. Yeah, now we have like a disability awareness day at the Capitol. Is that gonna be like a reoccurring thing that we do every year? Or was that just something that was like,
That was hosted by the,
Split Second Foundation and GODA. And I do, if I'm not mistaken, I do think that's something that they do want to have annually. Don't hold me to that. I
Yeah.
think I heard him say,
right?
the founder for Split Second Foundation say that it was gonna be an annual.
That might be a good initiative too, to maybe center if we were gonna try to do some sort of a curriculum or something to share with schools. If we tied it to Disability Awareness Day in that same sort of time frame, where maybe we have different other like months and days that are for other topics and historical things. It might be interesting to tie it together to with that. Hey, Adrian.
Hey, sorry. I just had a comment, or a suggestion. I'm finding this to do with my daughter. I'm an undiagnosed autistic female, and my signs were really subtle and easily overlooked, and burnout was really rough. Autistic girls and women are often underdiagnosed, misdiagnosed, or dismissed. Maybe more training or equitable identification for autistic women, because with my daughter, she's diagnosed and they're saying, but she doesn't present this way or that way. And so I'm having issues with I guess with stereotypes of what is and what isn't autism, if in a female versus a little boy, I guess. I don't know if that is familiar to anyone else, or if they've encountered the same sort of where they have this idea in their head, and that if it's not that, then it's not autism.
Thank you, Adrian.
so page 7. There's one last topic at the top, I think, that dealt with services and supports, and then it jumps into implementation issues and training. Anyone with questions, looking for clarity?
Okay, Gordon.
In terms of offering parents the option to participate in IEP meetings virtually, is there anything not to? I mean, it should be. It seems like it's a pretty affordable option for even schools that be doing it, everybody. So Jackie might know, right?
Jackie.
A lot of school districts do offer that option. I will say that, but they like for the parents to come in because they have signatures that are required. And it's easier to have a conversation when you're face to face versus through a computer screen. Because a lot of times, and I've witnessed this firsthand whenever I was teaching, a lot of times if we would do, because it was around the COVID era, if we were doing virtual IEP meetings, the parents weren't in the meeting. They were tending to their other children. Some of them were grocery shopping. So it's one of those situations where, and really for something like this, it's best to have, because they're supposed to be meaningful participants, it's best to have their undivided attention so that you can have good discussion, like this is what's happening at school, what's happening at home. What works at home? Can we use that at school? So that helps develop the plan, because when you're in these meetings, that's actually when the plans are supposed to be written. So.
There's a hand raised. Adrian Burns.
Adrian?
Great. Thank you. Along that vein, I totally agree, but on the signature point, I found as a parent that I preferred being able to look over the material and what we all agreed on and what we the IEP process and like able to sign like afterwards. When it's been IEP meetings in person, I often feel pressured to comply to what's going on at that moment versus being able to look at it and comprehend it, what we've been discussing. So that might just be an idea to maybe not make it where signatures need to be at the end of that at that meeting versus like you're able to have a digital copy and you're able to like think about it and sign it the following day. I know that I would appreciate that. I don't know if that's something that other people would like.
Thanks, Adrian.
One of your rights as a parent is to not sign the document at the end of the meeting. You can always reconvene the meeting to either get clarification on any questions that you might have once you sit down and actually go over the document. But a lot of school districts are actually sending out draft forms of the IEP, like this is what we're proposing. And then you tweak it in the meeting through discussion. And if you're satisfied with it and you understand everything, by all means, go ahead and sign it. But if you need more time, that is your right as a parent to take more time.
Thank you.
Can I ask a question on the chairman?
Yep.
Well, and you said that's your right as a parent not to have to sign that paper, but what if the school is behind in their paperwork and they like this telling
Doesn't
you,
matter.
That's not your fault.
we need this right now?
That's not
It
your
doesn't
fault.
matter.
The school, I want to say they have 60 days out that they could start having meetings with you. And some of them wait until the very last minute to do it. That is not your fault. That would put the school out of timeline. And then the IEP would lapse. And then they'd have to do another evaluation to do a new IEP. So that's the responsibility of the school. And then ultimately you can file a state complaint in regards to that.
Thank you.
Any more questions on page 7? So we can flip over, if not to page 8. That's our last section of input ideas, which deals specifically with employment. Melissa Bayham just waiting so patiently to answer all your questions.
Eric,
I took another time. Come on, Mr. Dan.
I actually do have a question more on the, with that first one dealing with the funding. So I know there was some funding that y'all were able to get out of last session. I guess where does that put the department currently? Like what are we still missing to be able to draw down that full match?
And so, it's a little convoluted, and I think y'all understand this because there's the state fiscal year, there's the federal fiscal year. So in terms of, to draw down the full grant, you need about almost $19.5 million. So we were able to get 4 million extra additional state general funds in the last session, which put us right under 12 million. So that still left us a little more than 7 million short, 38 million short overall, meaning that's how much we were not funded because we didn't have that state match. So this year, so we have to do what's called reallotment in August. And so in August, we have to tell the feds how much of the federal grant we think we're going to draw down for that federal fiscal year, which ends on September the 30th. So we kept about 40 million and sent back about 30 million this federal fiscal year, which just ended. So in total, to be fully funded, we need a little more than $19 million to draw down the whole 72 million that's allocated to Louisiana. I think I gave you all the numbers, but if you're missing any, let me know.
So you said 19.5 to get the full 72?
Correct. Now, that's a lot of rounding. I can get y'all exact numbers because obviously the grant amount is not a whole number. It's a strange number. And then there's some other things that we use as match. So the math is that if you try to do the math, because our budget is very complicated, but we need about 19 million to be able to draw down our full federal allotment. Because of everything going on in the federal government right now, we usually have an estimate on our what just started is federal fiscal year 26. We're just guessing based on what we got last year. It could be more, but we don't actually know how much the grant is for Louisiana for federal fiscal year 26 because the government is shut down.
And probably dumb question here. Would the 72 million be the full amount of total funding or just the federal match? So
That's just the federal side. So you do 72 plus 19.
Good.
So with, like I said, we did get 4 million additional state general funds this year, which was great. Which it helped. We obviously need a lot more in order to run, to me, an efficient and successful program. But with those additional funds, our budget was a little bit more comfortable in that what we've done, I know y'all have heard me talk about staffing shortages many times. And so we have procured 2 staffing contracts for pre-employment transition services. One for the New Orleans region, and that's Families Helping Families of Greater New Orleans as our contractor for that contract. And then we've also contracted with Easter Seals for Shreveport. So those 2 regions, now the pre-employment transition services coordination with the school districts will be contracted out to staff from those particular contractors. Really excited to see how that works because we're short-staffed. And so pre-EDS is obviously very, very important, but we don't have enough staff to cover pre-employment transition services as well as all of vocational rehabilitation. So those 2 contracts will have 3 rehab counselors per contract to be able to cover those school districts in those regions.
So how much are y'all? How many staff members, and this might be crazy, for you to basically have to be covered with what you need?
So we have looked at, best case scenario, just trying to be as realistic as possible with full funding, I would probably need about 198 staff,
Ouch.
but I already have 150. Yeah. But I mean, if you think about it, we only have half of our money. So that really is not too bad.
Mhm.
Do y'all have any idea, I guess, how any of the reduction in force might impact both rehab services?
So as of right now, we don't have a direct impact because we have carry forward funds from federal fiscal year 25. So right now there's still an essential employee at RSA, David Steele, who although he did receive a reduction in force letter, he still is working because he's considered an essential employee. So we're still able to draw down our federal funds from federal fiscal year 25. Now, agencies that run a little bit tighter budget than us, they're the ones that have lots of concerns because obviously you can't draw down your federal fiscal year 26 money at this point. Now, there's nobody there. So other than that one person who's doing all the financial things. So we can't get any technical assistance or anything right now. We also can't get monitored though, so. And I think that would be, now if the shutdown continues for a long period of time, at some point, it would obviously be a problem.
Yes. We're in the same boat, Melissa.
Yeah. But all the RSA staff receive those notices except for one or two.
Are you saying even if they had a hold, if they shut down more anymore, then it start affecting?
So we, states don't have access. So the federal fiscal year runs October 1st to September the 30th. So we just started a new federal fiscal year. So if you run out of your 25 money and you need your 26 money, you don't have access to your 26 money. So, VR is a state, obviously, what we first talked about, we require a state match. So you could use your state funds first. But then at some point, VR is 78.7% federal. So at some point, you're going to run out of money.
All right, let's vote.
Yeah, anybody else have any questions or anything? Okay. So Brenton and I were just discussing how we were gonna get you guys to narrow things down. I think it would be best if we go back in the same order that we went in. If you guys want to throw out an agenda item that you would like to be considered or voted on. For each section, throw those out. We'll keep track of them. And then we'll have you guys take votes until we narrow it down to the number of items that you guys think would be appropriate to send to the full council for a vote. Okay, so if we go back to page 1, the home and community-based services, if you look at the Medicaid / healthcare access, does anybody have anything in that section where they feel like they want to put that forth as an idea or as an agenda item for y'all to vote on as a committee?
I would like to see the universal changing tables in public spaces.
I was gonna bring that up too.
We're like, I understand things take a long time and we're like almost there where we are gonna be stuck. at home personally, just with
Yeah.
the way that it is now, so. Do we just name them, or are we gonna vote on them?
Well, once we go
Have a
through all the
list.
sections,
Okay.
then we'll start voting and y'all can start narrowing down.
Okay.
Yeah.
Yes, that one in particular, my only question was, is that federal advocacy or state? Because I just don't know, I guess I don't know enough about it, changing those types of things.
Yeah, is that gonna be an ADA?
Yeah,
I know there are some states who have done it on
okay,
a state level,
gotcha.
at least one. That is implemented it on a state level.
Do you know which one?
I'm looking it up now. This is AI, I could be wrong. Several states require universal changing tables, including California, Arizona, Minnesota, New Hampshire, Ohio, and legislation recently passed in Alabama and others introducing bills. Alabama was the last one in April of 2025. Requiring universal changing tables in certain state-funded facilities during new constructions or major renovations.
So state facilities specifically, not private.
Says state
Okay.
Like so
funded,
state parks
state-funded
and-
facilities.
Yeah,
Then it's
state
just
funds.
going
Yeah.
forward, not retro.
Yeah.
Or major renovations,
Yeah.
if they're undergoing major renovations for the new
Yeah.
item.
Angel has her hand raised.
They've essentially put it into code, I would imagine, for state building.
Angel.
Oh, hey, where's she?
She's on the phone.
Oh, yeah. I'm like, where did she go? Hey, Angel. Angel, did you have your hand up?
I did. Can you hear me now?
Yes.
Okay. This did not come up specifically at my community input, but I was in community not too long ago during a Washington parish. I think it was the Balloon Festival, and the director of the library, I was just kind of telling her what I did, and she brought up, and she was a confessional and just said, hey, we're doing a renovation on our building, and how do I find out about universal changing tables? And as I brought that up, I've had quite a few people just say, yes, that needs to be done. And not so much, changing buildings, but as they're coming up, requiring that to be done. I know just talking last year for session, I had a family come testify for me, and I know the Capitol is something completely different, but they came to the Capitol to testify, and she had to change her 16-year-old boy, which is like a man, in the back of her SUV in the parking lot at the Capitol to be able to come in and testify. But it's just, it's a growing problem, and no one really knows how to address it. I don't know if that's something that ADA can just require for new builds, like I said, major renovations, but it keeps coming up over and over and over again. So I just wanted to throw that out there.
Thanks, Angel.
Okay, any other items that you guys want to
Consider.
throw in the mix? Yeah. Under this section right here.
What's the second one?
Or the critical, protect funding for critical therapies?
I lost it. What is that on the critical funding for therapy? What that's,
That was the second one.
basically what that is.
I don't know if
Any of the
Kristen
leaders.
or any of the leaders that might be on the call know, there wasn't any additional information provided other than just that statement. So we're not certain if they meant the general sort of protect Medicaid funding, just given what's going on the federal level, or if there is something specific they had in mind.
I think a lot of these protect issues come back from the big beautiful. You know,
federal
yes,
cuts
the
over the next 10
worries of the
years,
work
yeah.
requirements, the worries of services being cut, of, you know, different, I think all of that kind of comes back to that. But it's kind of like the other thing that you said, it's been said, but nothing has actually been
Right.
done. So, you know, we don't really know what's gonna happen up to.
That also kind of goes back to what we talked about in the very beginning of just making sure that your agenda that you're gonna recommend, and then also for the council to make sure that the agenda that they pass can have the opportunity to build in those types of things where we can react if we need to. You know, if you develop an agenda that is quite long and an arduous task, then we have to come back to the council, we have to figure out what we could take off. Well, actually, internally, we could figure that part out, just depending on when things pop up. But I would imagine though, a lot of these that say protect Medicaid, protect services, those types of things. I mean, that's a given that it's gonna be something we would do if we notice any cuts are coming down during session.
Okay.
Yeah. And so we kind of did this last session. I at least got a lot of feedback from folks that I would talk to at the Capitol. It's kind of one of those things. And we started out with the protecting services because there was the thought that there might be a cut.
Okay.
Well, then they went in a special session, they fixed it. We still advocated for it, and we get a lot of scratching heads, like, we did this, why are you doing this? It's like, we just need to make sure. Because, you know, till it's over, you know? But yeah, I do think if you would start seeing any of these impacts, and that's part of the conversations we've had at council meetings as well. What is the impact? Some states are passing information out like, hey, this is what we anticipate might happen because of the passage of the big beautiful bill or the Medicaid cuts over the next 10 years. But our state is not one. So we don't have any information. I think we're probably not gonna see a lot of that information until we start getting into committee discussions
Okay.
during session. And then we might have to pivot at that point of if we need to educate on any possible cuts there. On the plus side, at least for the last handful of years, the department has been going to present their budget or their proposed budget well before session starts, usually. And the governor will usually present his budget before session starts, and it'll kind of give us an idea of what might be happening. Anyone else under the Medicaid healthcare access group there?
There's a hand raised in the audience.
Adrian Burns.
Sorry, it's me again. I guess clarification on they haven't outlined exactly how they're going to do cuts if so. Because I know I'd heard that they were saying that they were gonna cut the most expensive like services, but that was just in general, not like just disability, and that would sexual assault services was the most expensive, and then the second was OBGYN. So they were looking at possibly cutting those kind of services. But I was so they haven't. How else could they structure that? If you know, I don't know. Sorry.
Well, no, that's okay, Adrian. Brian had to leave. So we're not sure about any cuts at this point. I know he said that the budget that Medicaid turned in, there were not any cuts for the FY 27 session. For the FY 27 budget, I apologize, the 2026 session, but for their FY 27 budget request, there weren't any, cuts that they had included in their budget, so.
Well, that's awesome. Thank you.
Yeah.
On page 3.
Two, I think.
Yeah.
So it's under the community and family support system.
Mhm.
My conscience says we need pay raises. But I know what the response for that is gonna be. Cause he already told us.
I mean, Kristen, I think based on his statements, and I don't know if you feel this way too, Aaron, I think they're optimistic that the rate study is gonna come out very soon. I just, and so I think that we should have the information to include on the fact sheet, I guess, soon. So if you guys want to make that recommendation to the council, I encourage you to. I wouldn't put it off because we don't have the rate study yet. I think that if you guys want to advocate or make that recommendation to the council, that this committee should make that recommendation. That's my suggestion to this committee.
Okay. My issue is not really so much with the part, what I'm gonna go back and tell my family. That's what my issue with that is more, because that's the number one main thing that has been pointed out through every avenue in our state is that, and I know a lot of regions didn't put it on there because, we kind of already knew about the methodology thing, but,
It seems like if the pay was increased, then that could also maybe help with the shortage of workers, because maybe more people would want to do.
well, that's the whole
The job.
point. And I know that y'all brought some really interesting things that I didn't even realize today, about the floor, the limits and all of those kind of things. And I understand that it's gonna be some mess to make it happen, but unfortunately, gotta start having these conversations at some point besides, we're doing this, we're testing this, it's got to be better.
Tori and then Ally.
This may or may not make sense, but given that the rate study is probably coming up by the end of the year, that might not leave us with enough time to actually advocate legislatively for anything. If we were trying to do that or advocate the upcoming year, could we at least maybe decide to wait until the rate study comes out and use that information to start advocating for the process in the upcoming year, but knowing that it's probably, we might not get the actual increase. And knowing that it's, the timeframes might be too short, for the upcoming fiscal year to get it, or at least start the process of advocating for it based upon the numbers that we get in the rate study once we get it, which may or may not make sense.
I guess I feel a little more optimistic that we're gonna have this study
I do too.
in plenty of time to still advocate during session. Now, I'm not saying you're gonna get the money, because I've heard some really big numbers. And what I would like to see is if the study came out, have those conversations with the department to figure out, because the department has, in not so many words, made it pretty clear that they would like to follow the recommendations of the rate study for the most part. And so they are looking to get additional funding this year or a rate increase, we can try to figure out what that is, so we can try to support that request and have those conversations of, are they looking at a multi-year approach? Or are they just going full force this year and trying to get it all? So I think you're almost deciding if this is gonna be a placeholder, because it's probably gonna look messy and be a weird presentation of what what we would want to advocate for until it gets closer to session. But I feel like we're gonna have the information.
I do.
Because at least from what I've gathered here today, and from what I've heard in other conversations, it's written, it's just complicated, so they're rewriting it. And I don't think that is gonna take this extended amount of time that it was to do the study and all that. So I guess, I don't know, maybe I'm not smart for being optimistic. I don't know. I didn't get the impression from anyone in the department that I've spoken to that it's not coming out pretty soon. It's just being reworked. I would also say I see these things as going hand in hand as far as increased worker pay and the rate increases, because that's not Brenton talking, that was the council talking in 2024 when we were gonna go for this rate increase, was trying to figure out what the rate increase was to be able to justify also what the workers should be making. And I know that created a lot of animosity, and I've moved past that. I hope everybody else has. But I still think, and at least that's what the council voted on, whatever, a year or two ago, was the rates and the wage floor are gonna go hand in hand. It's not a separate issue. So you could potentially have that if you want to consider it as some sort of placeholder, and we might have to just kind of flesh out that what it's actually going to be when we get that information. But I feel like you're probably going to have some dollars and some numbers, and I think at least in conversations I've had, I think you have a fairly decent shot at getting that rule change for the wage floor if we can get some funding increases for those rates.
So bottom line, do you think that based upon when the rate study will come out, in the upcoming year or so, it may be in place by the next fiscal year, the 26-27 fiscal year, that we actually could have increased rates with the breakdown of who gets what in place?
Yeah, I think so.
I'm pretty
I think you
optimistic
can
about
get some,
that.
I think you can request some funding this session in hopes that it starts in July. And then I don't remember how long it takes for those rates to actually increase based on the funding you get, but they'll have to work through that process, and it takes a little time. You would also have to have the commitment of the council. If this is the price tag that came out of that rate study, that this is happening every year until we hit that amount. Because sometimes this council will pick something that they're aware is a multi-year approach, and we just do 1 or 2 years of it. Then we move on, but you got to commit if you want to get there. Ally?
Yeah, I just want to get some clarification on this. When you were talking about this earlier, Brenton, you made a note saying that maybe this is better for a rule change and not legislation, because maybe legislation would tie hand in the future.
Mhm.
So as a group, we're voting on what we want done legislatively, though, right? Not administrative rule changes. So like if we vote on this today, saying we want to recommend this for legislation, then does that not allow us to do a different route later?
You could do both.
Okay.
And so what has been done in the past has been a lot of advocating for these dollars and then putting pressure on legislators to educate them on how important these wages are for our direct support workers. And that pressure has been placed on the department, who changes the rule. And so I think you could tie those things in together, just knowing that legislatively, we are asking for these dollars to increase the rate. And then in tandem, we're doing this administrative advocacy as well to get the department to raise the floor.
Okay.
Yeah.
I have a question. Yeah, I was thinking the same thing, like because I had written down, was it an initiative, but not legislated? So I guess what we're saying is even though the rate study will be completed and we'll have the results of that, and there's no way they're saying they need to be paid less. It's obviously gonna be paid more, but we still need to, in some capacity, have an initiative or or approach it legislatively to have that rate increase go into effect. Because even though the study's done, nobody's gonna be held to that study. That study doesn't force anybody to increase the rate,
Correct. It just says this
just
is where
says
your
what you
rate
should.
should be. This is.
the recommendation.
It's just gonna say this rate is too low. It might say this rate is too high. I don't know. I haven't seen the study, but yeah, it's just giving you factual information about this is what we think workers should make based on X, Y, and Z, maybe in some other states that we looked at. This is what you currently have the rate at. We think it should be X amount of dollars instead of this amount. That's pretty much what, and it'll give you the why. But it's not gonna, none of that will happen unless you get the funding to do it. Or the department just finds some funding to do it, but my understanding is the price tag is probably not find some funding to do its size. It's probably some extra dollars are needed size.
Yeah,
We're gonna
okay.
have to take a multi-year approach size.
Yeah. Yeah.
Got it.
You got $150 million laying around. Give us a
Check
call.
my couch.
Everybody get your penny. But yeah, so I wouldn't. Worst case scenario, we are running in a session and we still don't have that rate study, which I don't think is gonna happen. And you still advocate for getting that study and getting the information, getting the dollars that we need to at least start increasing those rates. Maybe I'll stick my foot in my mouth if that study doesn't come out, but I really do feel like it's supposed to be coming soon.
Yeah.
We've been talking for 2 months about this thing.
Yeah.
But so I wouldn't shy away from it, is all I'm saying, just because we don't have it in hand right now. Yeah.
With that getting.
Well, I was about to ask, was there anything under community and family support system that y'all wanted to add?
DSW support worker pay raises. Yes.
Y'all want to tack some rates on that, or y'all just wanted to?
You said 150? Were you joking?
No, he's talking about the rate, the
Okay.
actual rates.
Or the actual rate?
Yeah, the rate.
I'm like, are you
I
talking
just,
like a whole?
basically
think?
what I was sharing with you is gonna look a little bit differently than the way it's written right here.
Right here, yeah.
I'm saying you're taking a multi-year approach, where each year you're trying to increase the rate a little bit more and you're bringing that wage floor up each time. Cause you're gonna wanna tie, at least this is what the council said a year or two ago, whenever it was, you wanna tie that wage floor to that rate increase and keep bringing them up together
So it's $18.50 now.
currently. We don't know what it's gonna be after that. Till we get the
So
study.
you can tie them together is what he's saying. So if you increase the provider rates, you can say something like increase the provider rates with an increase in the DSP wage floor.
I see what you're saying.
You see?
Yeah. Because we would advocate at the legislature to get those dollars. Let's say we are using that $150 billion, right? Let's say we're gonna do 25 a year. So this year, you might be going to the legislature saying we need $25 million to increase the rate to whatever number Erin and her team gives us, that would increase the rate to based on that dollar figure. And then we would also be having those same conversations with the department and with legislators about that rule change of bringing those two up together.
So we need to word it in a way that says not just for the direct support worker pay raises, but also the
actual.
what was it called? The provider rate.
Mhm.
So increasing provider rate and direct support worker pay.
Mhm.
Yeah,
Exactly.
yeah, increase in waiver rates and direct support worker wage floor, I guess would be.
Yeah, but my thing is with this, my question is with this. I'm for it, but this is my thing, and I was fighting for it on the board. Is even if we get this increase, my thing is it gonna go to the direct support workers? That's my only concern. Is it gonna be where they not gonna get what they supposed to get? And the other people say, oh, no, we didn't get this. That's my only concern of it. We didn't get this, but we're gonna still give you this. If y'all understand what I'm saying. And that's my only concern with the whole situation. We don't want the companies to just take the funding and then not give it to them, because I feel like if they get the fundings like they supposed to get, I think we'll get better direct supporters that really wants to stand up and do what they have to do, because you gotta look at it. We got companies, but then they don't do the job that they do. And then they don't get what they supposed to get. And I hope I'm making sense that they send them out there to take care of us, but then yet they only see the end of it. And they sitting getting all of it. And I don't think that's right. If I'm making sense to everybody in this room.
Yeah, it makes sense.
Yeah.
And that's what we're saying. So if you increase waiver rates, but you done the waiver floor, the wage floor. So let's say we said the rate's $18.52 right now. Let's say you advocate this year and it's gonna go up to $22.50. If you don't increase the wage floor, then none of that has to go to the worker. But if you increase the wage floor, then that's saying every direct support worker has to be paid this amount, which means the provider is gonna have to use what has come from the funding, that increase in rates to pay the workers more. Now, what's not gonna happen is, if let's say you have a worker that's already making $15 an hour and the wage floor is bumped up to 13, well, they're not gonna get any of that money.
But I
because they're already
understand, but if
making
you do
wage.
direct support where you're doing it independent by yourself, instead of you going through a company, of course, self-direction, I know they not gonna get that, but my concern is if these companies out here not giving it to them and saying, okay, we didn't get this, so we gonna give you this, and we lose people, good people, and then we get the bad people, and then this is where our situation at. That's my concern.
I think if we increase the wage floor, then more people will wanna, the pay will be better. So if the wage floor is $9 and we increase the floor, just say, like you said, to 13, then better people and maybe even more people would be interested in the job, in the position.
Yeah. That's what I'm saying.
And that's information that we should be getting out of the rate study per what Brian said, or maybe it was Aaron, one of y'all said it. I can't remember who, but yeah.
That's just my concern.
So we just have to make sure to tie, like they're saying, to tie the two together. If we increase the provider or the agency rate, then we have to increase the direct support worker floor.
Yeah, that's a
Or that-
lock-in rate. Basically, what that does is just locks in and says they have to
They
pay
have
at
to
least
pay
that.
that much. Yeah.
No matter what amount of money they get, this is what they have to pay. So it makes sense. It's a way to strong arming without strong arming.
Kindly.
That's my only concern, and that's how I'm speaking, that's how I'm looking at it. And I feel, listen, I'm gonna leave it alone. I feel like if you're a direct supporter and you not qualified, I don't think you should just be able to open the door and say, okay, you got a spot, but you're not. No, I think it's supposed to be a little more stipulation. I'm just speaking. I think it should be a little more stipulation. Just giving them a spot and they not. to the point where they need to be.
Anything else under community family support system? The next section would be the sun screenings. Which my opinion, none of those are done legislatively. Same with SSI, I don't think you're tackling that in your state legislative section.
We got over two, so
We're on 3.
Then we're down to protection and rights.
The response system, of course.
Yeah.
in this green,
Great.
Yeah, the very
The top
first.
three.
screen.
Christine
have
said
no
she
more.
had a proposal. She would email, if, I don't know if that helps.
Well, yeah, I think she's
Somebody to
been
carry
speaking
it.
to a legislator, yes.
oh, okay. Good. All right.
I don't think the way it's worded is
I think the whole mess is one box.
emergency alert.
Emergency alert
System, I guess.
for lost individuals,
Yeah.
not just children.
Yeah. Well, that's what it says when it pops up on your phone, or what, emergency alert, or, you know.
Mhm. Amber alert.
So
or-
we create an emergency alert designation basically for designations, even the right word.
Madam Chairman, I
Say emergency.
Yes.
I thought the emergency alert for
He's saying create.
state of Louisiana, I thought we had this stuff. I thought we already had the emergency alert where it's for disabled and all that. And y'all saying it's not,
If it is, it's not being utilized appropriately then.
it's not bad.
If it is, I'm not, I don't know whether it has it or not.
I haven't heard that thing in a while.
Okay.
So we have that one, we can kind of
I did,
wordsmith it.
none of this is gonna be great wording because there's so much research that goes into after this whole process, but more so create and or amend an emergency alert system specific to individuals with IDD. Creation, meaning you could create your own emergency alert for folks with IDD, or you could have some sort of add-on like other states are doing where you attach this designation to an active amber or silver alert, something like that. But yeah, we will
And that sums that up.
figure that out. We'll also do a motion after y'all motion for your specific recommendation that gives us the ability to kind of wordsmith and figure out how this should be written before the council meeting to kind of better understand the conversations that we're having here and the topic.
So any other items under protection and rights? Did anybody still?
There's a hand raised.
Is it from the public?
Yes.
Just for the sake of time, we're gonna hold public comment until the end. Sorry, guys.
Yeah, we do have about 30 minutes left.
Yeah. Okay, so if nobody has anything else in protection and rights, we're gonna move on to early steps in childcare. Any of those?
That starts on page 4
Mhm.
of your document.
All right, what about training and education? And that's still on page 4. Okay. Let's move on to page 5, transportation and safety. Any of those issues?
The task force,
Okay. So the second one, Kristen.
yes, ma'am.
Okay.
Because essentially that's what the rate methodology thing is. I mean, we're just getting a head start on it. To give us the numbers and the background on what we're asking for, you know, just, we'd have to do that anyway.
The only difference would be this is gonna have a price tag that the rate methodology did not come with.
Well, yeah, that's true.
The rate,
Just a
the rate
loose
methodology, you're able to
generalization.
use ARPA funds.
Yes.
Your task force here, you're gonna have to create within a department and fund it. So just keep that in mind.
So you'll come up with a price tag for us?
I thought you had mentioned.
No, because I don't know. I'm just more concerned with if you're trying to go for increased rates and wage floors, that you're then coming in with something that might have another price tag on it. And that's more what I'm worried about.
Gotcha.
But not knowing what that price tag is on the rates and stuff, I don't know if it is something I'm worried about.
That's the trouble, they tell me.
I'm sorry, I thought we had mentioned also you possibly doing like a study, like a transportation study within the council that we could break up over, like in our 5-year plan.
Mhm. That is something that the council can decide to do once we get to that 5-year plan. If you guys want to allocate funding towards that initiative, you can. So that's another option to consider, Kristen, that the council can actually put funding, some of their funding towards an initiative for transportation. And they do have, one of their goals and objectives is focused on transportation. So that is something that the council can do. Okay.
But just so I'm clear, right now, you are just throwing out ideas and then you're gonna whittle them down. Okay.
We want all of them.
Do it. You're there with us. Let's go. I might need you to help write some things.
All right, anything else in transportation and safety? If not, we're gonna move on to housing. All right, housing starts on page 5 and it ends on page 5.
Karen, if you can hear us, we can't quite see you on camera. There you
There
are.
you go. Okay, so nothing for housing. We're gonna move on to education. Page 6 is education. So we have a bunch of education issues. The first area is behavior, second is curriculum, the third is access to services and supports. Any of those items resonate with anything? Okay, Tori,
The earlier functional behavior assessments.
gotcha.
Thanks.
Yep. Okay, any other items under curriculum or access to services and supports? Okay, If not, we're gonna move on to page 7. We have implementation issues for education and then training and education. So any of those items anyone wants to recommend?
This number one.
Page 7.
Mhm. No, nobody? Okay, so we'll move on. The last page is page 8, and that's all about employment. Does anybody wanna offer any agenda items on this page?
I would love to see the state funding for LRS so that we could fully match the federal drawdown.
And Melissa, that 19.5 rough estimate, that's SGF, right?
Yes, and I can, if you need it, I can get you some better numbers. Because that wouldn't be we already get almost 12. So
Yeah, I was gonna
That's
ask
right.
that question.
So you
Okay.
might want to do the additional, because it's a lesser number.
Okay,
Okay,
Like the additional 7.5.
so additional funding.
And
yeah,
I can get y'all the exact number.
so the 12 mil is reoccurring every year?
It's in the governor's budget.
Okay.
Or it was, I mean, I'm sorry, it's not it was in the main budget bill. It wasn't in the supplemental.
Okay,
So from what I understand, we should expect to see it reoccurring. But
okay,
I guess you don't know until the
Yeah.
governor's budget comes out.
And that was what y'all were getting and what was received last session.
So
The last session was,
the almost 12 million was, they added 4 million.
okay,
right, so it's what y'all had, there was 4 million added to it, right, okay.
okay.
So 7, 8 million more maybe, or so rough
Yeah,
estimate.
it's between 7 and 8.
If that 12 mil is in there,
Correct.
okay. Gotcha.
And Lighthouse Louisiana is also meeting to discuss this as well on
Okay.
Monday, so I can let you know how that
How that
goes
go?
there.
But that additional 7.5 would give you an additional 30. Y'all sent back 30, pretty much.
Yes,
You got,
so,
kept 40, or you got 40.
Correct.
Sent back 30.
correct. Now, it's not an exact science because it goes between 2 grant periods, but
So estimated roughly 7, 8 million, that would pull down the full
It would be
72
72.
million.
Yeah.
Okay.
That's just for my notes. Okay.
Which would be an increase of 40 million for them,
Mhm.
because,
In the federal funds, yeah.
no, 40 million, like the total, they had 52 this year, and if they were to receive the full federal drawdown, they'd have 91.5,
Yeah.
somewhere around 91, 92, like $40 million more a year.
Yeah.
For 7. If they could get the 7 or the 8, whatever, 7.5.
Okay. Does anybody have any other recommendations for the committee? You guys narrowed that down way quicker and well, way more than I thought you would. I thought we were gonna have like 12 items.
We have 6.
We have 6, great.
But, I don't know,
I'll share, so you can share.
figure out where.
We don't have to narrow them down any further. We can leave it at that.
Well, no, I think, well, it depends. Again, it depends on how many y'all wanna like recommend to the council.
I know.
We always, the staff always recommends 3 to 4 items. So I would try to narrow this list down to that 3 or 4.
It's a good slash version. The worst thing they would do is say no.
So,
Figured I'd try.
I mean, unless it ends up being small, I don't really have a way of making it much larger for you, where you can see it all at once, but. So, don't worry about the bulleted stuff, that was just me typing down things. So under the Medicaid healthcare access, y'all had mentioned, universal changing tables in public facilities. The community and family support system area, it was looking at those, waiver rates and direct support worker pay. Under protection and rights, it was creating or amending or adding to basically an emergency alert system that is specific for individuals with intellectual and developmental disabilities. Transportation was the creation of a statewide transportation task force, study transportation issues throughout the state as relates to individuals with IDD. Under behavior, so this would fall under education, require districts to conduct functional behavior assessments earlier to ensure behavior intervention plan is in place before continued removal. Is that the best way of writing that? For those of you that were chatting about it, is there another way? Because I know how we have it on the sheet is not always the.
Yeah, I still am confused. Earlier is weird to me. It feels very arbitrary. But I also don't know how you would nail it down because you're looking for patterns of behavior and how often things are happening and all the different things.
I'd probably actually put numbers in there saying like, you know, after so many behavioral write-ups, and I would make it to the point of a write-up rather than like, oh, you got a mark on your conduct or something like that, because those are gonna be the more extreme behaviors. Typically, the conduct sheet's gonna be more of your classroom management behaviors rather than those more extreme.
So instead of earlier, you suggest that we put like after 5 write-ups?
I'd say put something along those lines, like 3 to 5 write-ups, or I'd even say at the initial evaluation and or like the 3 to 5 write-ups within a time frame. Like this would be something that we have to like sit and actually discuss. We're gonna change all this word verbiage. And I'd also put it in there upon the request of a parent, administrator, teacher. Because we don't want to take that right away either.
Yeah, I mean, I guess at that point, you'd be looking at, I would imagine this requires a piece of legislation. Not super familiar. I don't know if this is more of a policy thing or a Bessie thing. I'm taking y'all word that I guess this is a bill that we would need to run this session. So that sounds like stuff we'd have to get into detail of how you would want that worded. But this is more so to capture, I guess, the general idea of what you're trying to accomplish. So that folks would, I guess, understand it. If you select this to be on your agenda for the council to be able to understand what you mean, for you to be able to present to the council what it is that you mean by this. And then those details is what we'd have to work out. Yeah.
After. I'd even say as necessary, I guess, for the sake of moving this along. Take out earlier, put in as necessary. And then we can talk about if this is something that the council would vote on, then we can talk about those specific criteria.
Committee members.
Yeah, as necessary, then we go from there. Then we sit down and work.
And that replaces earlier, is that what?
Yes.
As
We're trying to
necessary to
say.
ensure a behavioral intervention plan is in.
I had it got cold.
And then under employment, it's the additional funding for Louisiana Rehabilitation Services or LRS. Ensure they draw down all federal matching funds. So those are the 6 things that you've kind of whittled everything down to. So at this point, you can collectively decide if you want to whittle some weird going on my computer. It's not showing up on there, but I should save. Sorry, just pause for a
I
second.
would, can I make a suggestion, Elena? I would suggest that you guys, as a committee, decide how many items you guys want to recommend to the council, whether that be 3 or 4. Once you make that decision, then we can vote. And everybody will get 3 votes. And then you guys can whittle this down to 3 things. Cause whatever gets the most votes is essentially what you're gonna recommend to the council.
Yeah.
So as a committee, I would suggest that you guys decide whether or not you want to recommend 3 or 4 items, and then we can start taking votes.
No, okay.
Cause we're about 15 minutes out.
Can we just do a hand raise for 3 and or a hand raise for 4 and see?
Someone, did you have something, Karen?
I think we ought to go with 4.
Okay,
Okay, so Karen votes 4, and so we can take a vote in the room out, I can count. So
For 4.
raise your hand for 4. Okay, so there's 1, 2, 3, and 4. That's 4. How many, do we have 6?
We have 6, including Karen on there, yeah.
So if 4 of you guys voted for 4, that's the 4s win.
okay.
Okay, so you only get 4 votes. So 2 things will not make it to the actual council. So we can start with the first item. Brenton, if you pull it back up.
Why it looks like this on my end, but I don't think it does on Zoom, so we'll try it again. I think Stephanie's computer is cursed mine,
Someone's gotta be cursed.
except I think mine is doing it all over my screen instead of just at the bottom like yours is.
Oh, is that?
Okay, so it shows up fine on there, which is nice. I don't know what it's here. Okay, sorry. Troubleshooting, what y'all decide to
Okay,
do.
so we're gonna vote. Everybody gets 4 items that you can vote on. Once you vote 4 times, that's it. Okay, so we'll start with the first one. All those in favor for are the universal changing tables in public facilities, raise your hand. And Karen, you'll have to verbally say yes or no for that one. Or you can just say yes if you're in favor of that one. And if you don't say anything, we'll know you're not.
And just to let you know, this is not a motion of any kind. This is just
This
you're
is just
trying to
narrow this down.
get to the 4 that you want to recommend.
Okay. Anybody for universal changing tables?
I changed my mind.
Okay,
That's all right.
yeah, that's fine. All right, now we're on to community and family support system. The increase in waiver rates and direct support worker wage floor.
Karen says yes.
So
Okay.
all members,
All members of the committee voted for that one.
okay,
Okay, now we're on protection and rights. That's to create, amend, or add on an emergency alert system specific to individuals with intellectual and developmental disabilities. So all those in favor of that one, raise your hand or say yes.
Yes.
Okay, okay, so that's 5 members.
I'll need the change in table if I don't have a DSW.
Okay.
Things that come before.
Looking at your transportation one, the statewide transportation task force. 2. So behavior requiring districts to conduct functional behavior assessments as necessary to ensure behavior intervention plan is in place before continued removal. Oh, Karen,
Hear from Karen.
I don't think she's voting.
I'm on, yes.
you're a yes. Okay. And then under employment, the additional funding for LRS to draw down those federal dollars.
Yes.
1, 2. What's this?
1.
Okay. So you have a majority for the rates and workers, the emergency alert system, the behavior, and LRS. So that would be 1, 2.
That would be 4.
2 funding issues and 2 bills. Y'all gotta give me some legislators now if y'all wanna run some bills.
Okay.
Well, we may have
Well,
one.
we have one.
Yeah.
Miss Peanut Gallery can get us the behavior one, I guess.
Oh, but then we have 2.
I did.
Okay.
Okay, so does anyone want to make a motion that would add these particular items to your advocacy agenda?
So
Tori is making a motion.
Second.
I can second. So Tory motions to recommend the full council.
Ally, that second.
Ally seconds.
Okay.
ITZ.
Oh, I need that. I can't really see much. It's very blurry. You got glasses almost the same.
All right.
Okay, hold on. Let me talk amongst yourselves. Let me try to get your
That is
stuff
the
copied
question.
over.
Do we have any discussion?
Yeah, just let me,
Yeah, he's gonna do it.
I want you to be able to
and
have it on the
display
screen.
For you, so you
Okay.
can read it, yeah.
And then keep in mind, we'll need to do that last motion to just make sure.
Look, I skipped. Motion to recommend. I did start them out. You have to vote.
Oh, we'll get that in a second. Give me a minute. 'Cause once I pull it up on the screen, you'll be able to read it, and then we could do discussion, public comment,
Got it.
and then we can vote. Okay. So if you would like to read the motion, so we have a motion on the floor.
Okay. Wait,
So you can just read.
You just read the
You just
motion.
need to read what
Say
they-
this is on the screen is the motion that we have on the floor currently.
okay, so the motion that we have on the floor is to be considered by the full council for inclusion in its 2026 legislative advocacy agenda is for increased waiver rates and direct support worker wage floor, create, amend, or add on an emergency alert system specific to individuals with intellectual and developmental disabilities, to require districts to conduct functional behavior assessments as necessary to ensure a behavioral intervention plan is in place before continued removal, and additional funding for Louisiana Rehabilitation Services to ensure they draw down all federal matching funds.
Correct.
Okay.
So now discussion.
Is there any discussion?
Oh, now you stop till Tori comes back.
Okay.
Because we lost the quorum.
Pause.
I will say this, what I'll do is I'll get the information, the current information on the FBA requirements. That way y'all can have more exact information whenever y'all bring it to.
Do we have any public comment?
None online.
Okay. Any objection? Oh,
From here, no.
That's enough.
any objections? What's abstention?
We'll get to it in the roll call.
Okay.
In order to pass, I'm gonna vote here. So in order for you to recommend this to the council, we have to do a roll call vote. You can, whenever your name is called, you can say yay, which says you are in favor of these four things going again to the full council for a vote in October. So this doesn't mean this is your agenda. This is just what you're sending to the council. Nay would be you do not agree with this motion. Maybe you want to change something, you don't like something for whatever reason, you're disagreeing with this particular motion. You can also abstain if for some reason you have some sort of conflict here with any of these particular items. Then, for instance, if Melissa was actually on the committee, she would probably abstain because we're trying to advocate for money for her department. That's sort of a conflict. So you would abstain from that particular thing. Okay. Everyone clear on what you're voting on? Okay, Miss Artis. I see you. Can't hear you.
You're muted, Karen.
When it's safe to do so.
I agree.
Okay, Miss Artis is a yay. Mr. Blunsky. Miss Hano. Miss Cowitz.
Yay.
Yay. Dr. Mehta. Mr. Piontek. Miss Reed.
Yay.
Miss Reed is a yay. Mr. Rocca.
Yes.
He is a yes. Mr. Rocca, yes. Mr. Taylor.
Yes.
Taylor, yes. 2, 3, 4, 5, and Miss Shastry, it's not a tiebreaker, but would you like to vote?
Yay.
But unanimously, approved with a vote of 6-0 with no abstentions. Just gonna highlight that it was passed.
Do I have to read it all over?
No, the motion is here on the screen if anybody would like to look at it. So motion is passed. This is what is gonna go to the full council in October at our October 30th meeting. For those of you listening, it generally happens in the morning time. Usually before lunch is when this is addressed. The one thing I would ask as your staff would be a motion that would allow us to maybe clean up the language a little bit if we need to kind of capture what it is. The only ones I'm really worried about is just making sure the language on 2 and 3 are appropriate for what we're trying to do.
I motion that we allow you to clean it up.
Great. Give me a minute to you to respond. I don't even know if that's the best way to word that, but what do you think? Is that fine? This allows the ability to review and edit wording. Oh, I put word in there, yeah. Okay,
Yeah, I think that's.
okay, and that was made by Eric Taylor. Do we have a second?
Second.
Tori Braca. Any discussion? Oh, sorry, I'm taking your spot, Elena. That's your
Yeah, okay. Any discussion?
the day. I'm just trying to get y'all.
Do we take public comment? Any public comment? Any public comment?
Elena, I have a comment. This is Karen.
Hey, Karen.
Take care.
Hey, I just wanted to see if it would be out of order or if we could put as a recommendation from this committee that the whole council consider the transportation issue as it was presented to be passed on to them for consideration as a plan of work, as you suggested, Brenton.
So there is a motion on the floor though, so we can't tackle that right now.
Oh, gotcha.
Yeah, you have to just go off of the motion that is currently on the floor, which is just to give us the ability to adjust any of the wording of the motion y'all just passed of those agenda topics if needed, to kind of make it make sense. Might actually be all right, but just in case. Was there any public comment? No?
No.
Okay. We'll do the roll call. So again, yay is just giving staff the ability to tweak the wording if we need to make sure that it's easy to understand what we're trying to do. Nay would be to not give us that ability, and then abstain if you feel like it would be a conflict for you to vote to do so. Ms. Artis?
Yay.
Yay. Mr. Blinsky? Ms. Hano? Ms. Cowitz?
Okay.
Ms. Cowitz, yay. Dr. Mehta? Mr. Piontek? Ms. Reed?
Yay.
Ms. Reed, yay. Mr. Rocca?
Yes.
Mr. Rocca, yes. Mr. Taylor?
Yes.
Yes, that is 5 yeas. Good. So that
The motion
passes
passes.
5-0. Okay.
She's trying, she she just wanted the committee to make sure that they brought that up. And like the committee report.
Yeah,
Hey, Karen.
were you trying to make a motion about the transportation topic, or did you want us to include that in the chair's report, encouraging the council to consider that as something when they're doing their planning for the next plan?
The chair can do that. That's fine.
Okay. Write myself that note now.
Thank you, Karen.
You're welcome.
I can move to announcements. Okay, please note that our council meeting will be held October 29th through the 30th. It will be at Blue Bonnet Library in Baton Rouge. This is the same location as the last meeting. You can go to the council's website and register to participate virtually. The link to the meetings will be sent after registration. All documents as they are received will also be added to the council's website. As a reminder, the recommendations from today will go before the full council on the second day of meetings, October 30th. Does anyone on the committee have any other announcements to make? Do we have anyone wishing to share public comment? Okay, if there are no other comments or announcements, I hereby adjourn the meeting at 3:33. Thank y'all.
Thanks, everyone.
Thank you, guys.
We got out here a few minutes late.
Thank you.
Thank you, Karen.
Thanks for jumping on, Karen.